Good day everyone, I am Ramona Sogorio, together with Miss Angelica Gonzaga, and we will be talking about coronary artery disease. So first things first, let's talk about what coronary artery disease is. Basically, it is a narrowing or blockage of your coronary arteries which supply oxygen-rich blood to your heart. This happens because over time, plaque including cholesterol build up in these arteries limits how much blood can reach your heart muscle. So let's picture two traffic lanes that merge into one due to the construction. So traffic keeps flowing just more slowly. With coronary artery disease, you might not notice anything wrong until the plaque triggers a blood clot. The blood clot is like a concrete barrier in the middle of the road. The traffic stops. Similarly, blood can't reach your heart, and this will cause a heart attack. So, there are two main forms of coronary artery disease. First is the stable ischemic heart disease. This is the chronic form. Your coronary arteries gradually narrow over many years. Over time, your heart receives less oxygen-rich blood. You may feel some symptoms, but you are able to live with the condition day to day. Another type is the acute coronary syndrome. This is the sudden form that is a medical emergency. It is because the plaque in your coronary artery suddenly ruptures. And when it ruptures, it forms a blood clot that blocks the blood flow to your heart. This abrupt blockage causes a heart attack. So let's talk about the prevalence of this disease. So according to the 2023 data from PSA, revealed that the top three causes of death in the country from January to December 2022 is ischemic heart diseases, neoplasms, and cerebrovascular diseases. So the ischemic heart disease were the main cause of death from January to December 2022, accounting for 114,557 cases or 18.4% of all fatalities. While in 2022, there were 315 million or 95% uncertainty interval 273 to 362. So, prevalent cases of coronary artery disease globally. So, Central Europe, Eastern Europe, and Central Asia had the highest age standardized prevalence in 2022. So, 8,019 per 100,000, 6,530 rather, to 9,719, while South Asia had the lowest, which has the 2,393 per 100,000 or 1,746 to 3,188. So the symptoms of the coronary artery disease happens when the heart doesn't get enough oxygen-rich blood. So the coronary artery disease symptoms may include chest pain, also called angina. You may feel squeezing, pressure, heaviness, tightness, or pain in the chest. It may feel like somebody is standing on your chest. The chest pain usually affects the middle or the left side of the chest. Activity or strong emotions can trigger the angina or chest pain. There are different types of angina. The type depends on the cause and whether rest or medication or medicine makes the symptoms better. In some people, especially as women, the pain may be brief or sharp and it feels in the neck, arm, and the back. The next symptom is the shortness of breath. You may feel like you can catch your breath. Another is fatigue. If the heart can pump enough blood to meet your body's needs, you may feel unusually tired. So, the symptoms of the coronary artery disease may not be noticed at first. So sometimes symptoms only happens when the heart is beating too hard, such as during exercises, and as the coronary arteries continue to narrow, symptoms can get more severe or frequent. Now let's talk about the diagnostic exams of the coronary artery disease, which includes um, electrocardiogram or ECG or EKG, echocardiogram, exercise stress test, heart CT scan, heart catheterization and angiogram, blood test, and lastly, the nuclear cardiac stress test.
So for the medical management, it involves a combination of lifestyle changes and pharmacotherapy. So the key treatments include the lifestyle modifications, which are the smoking cessation, regular exercise, and a heart-healthy diet, and weight management are crucial for improving heart health and reducing the risk factors. So the next is the medication. So statins to lower the LDL cholesterol, beta blockers for hypertension, and aspirin for cardiovascular event. So prevention are commonly prescribed. And the next is monitoring for the regular checkups to assess the blood pressure, cholesterol, and glucose levels to help manage the CAD effectively. So these strategies aim to alleviate symptoms, prevent complication, and enhance the quality of life. So for the pharmacological management of the coronary artery disease or CAD focuses on the symptom reliefs and preventing complications. So the key medication classes includes the antiplatelets, which are the aspirin and clopidogrel to reduce the blood clot formation and lowering the heart attack risk, as well as the statins to lower the cholesterol and stabilize plaque in the arteries. And beta blockers to decrease heart rate and blood pressure, alleviating angina, as well as the ACE inhibitors or ARBs to manage the hypertension and improve the heart function. Calcium channel blockers used for angina relief when beta blockers are ineffective. Also, nitrates may also be prescribed for angina management. Some people need a procedure or surgery to manage coronary artery disease. So it includes the percutaneous coronary intervention or the PCI. So this minimally invasive procedure has another name, which is also called coronary angioplasty. So your provider opens your blocked arteries to help blood flow through it better. So they may also insert a stent to help your arteries stay open. So the second one is the coronary artery bypass grafting or CABG. So this surgery creates a new path for your blood flow around the blockages. So this detours restore blood flow to your heart. So CABG helps people to have severe blockages in the several coronary arteries. So the next one is transmyocardial revascularization or transmyocardial laser revascularization. It is a surgical therapy developed to treat patients with debilitating medically refractory angina, bacteria due to epicardial coronary artery disease, that it is not amenable to treatment using the traditional method of percutaneous coronary intervention or the coronary artery bypass graft surgery. So here are some nursing management for the coronary artery disease. So the first one is to monitor the cardiac status, regularly check or monitor the vital signs, ECG and symptomatology. The second one is the lifestyle modification education. Educate the patient about her diet, exercise, smoking cessation, and weight management. So the third one is the medication management. Administer and educate about the prescribed medication, like for example the antiplatelets, statins, or the beta blockers. And for the pain management, we can provide and educate about the angina pain management strategies. And the last one is the psychosocial support. We can offer emotional support and counseling or referrals as needed. So let's proceed to the prognosis of the disease. The prognosis of the disease depends on the multiple factors, some of which could be modified while others are non-modifiable. So it includes the patient's age, gender, family history and genetics, ethnicity, dietary and smoking habits, medication compliances, availability of the healthcare and financial status, and the number of arteries involved are some of the factors. So comorbid condition including diabetes mellitus, hypertension, dyslipidemia, and chronic kidney disease also have a role in the overall outcome.